And third, we're going to work with those policymakers directly to seek champions for our cause on both sides of the aisle, both in the legislature and in the new administration. We are so pleased to say that Governor-elect McDonald has already recognized the need for change in the children's mental health system. As a candidate, he acknowledged that community-based care for children needs to be provided in every region of the state, and that the confusing array of state departments and funding streams needs to be streamlined so that parents don't face a confusing array of choices, or a lack of choices in many cases. We are here to say, Governor-elect McDonald, that the Campaign for Children's Mental Health stands ready and willing to be your partner, providing the information and support that you need to make sound policy decisions to improve services for Virginia's children. In light of the current budget situation, we know that transforming Virginia's child mental health situation cannot be accomplished overnight. Our campaign is a long-term one. But in this fiscal climate, it is especially important that we not go backwards as a state. The community mental health system has already taken cuts, and we call on our legislators to spare children with mental health needs from any further reduction in services. You can see from our map that services are already at a bare minimum in many areas of the state. The campaign will work steadily over the next 3 years to greatly reduce or eliminate the barriers to service that John mentioned at the beginning of the press conference. At the end of 3 years, the Campaign for Children's Mental Health will have succeeded if we have made significant progress in the following 3 areas. First, if there are more community-based mental health services available to children in every region of the state, and if it's a wider array of services from the least intensive to the most intensive services. Second, if state government is more streamlined and coordinated so that families do not have trouble accessing services at the local level, regardless of where they go for help, whether it be to a community services board, to their child's school, or to any other system in their locality. And third, we will be successful if steps have been taken to develop a stronger workforce with specialized training in treating children with mental health problems in evidence-based best practices. So we're going to hold ourselves accountable, and we know that you will too. These are the goals that we're setting for ourselves, and this is how we'll know if we've made a difference for the children of Virginia. Again, I want to thank you all for being here. I want to thank all of our partners who are here. We have another funder who is in the room, Carillion Health Systems. Mark Lawrence, thank you so much for being here. Our other funders are Inova and the Community Health Foundation in Northern Virginia, and we want to thank all of you so much for being our supporters. We encourage you to visit our website and learn more, and to sign up as a partner organization and to tell your story for parents. And we are all going to be here to answer any of your questions right now or to take questions afterward. So I'll open it up for questions. Yes?
In the past couple of years, reforming the mental health side has taken things like the legal stand a little bit over 20 years ago. The reforms you're talking about anything to do with the specific services available or required in the process for changing the process for children to access the service?
I think what you're referring to is mostly the work out of the Commission on Mental Health Law Reform, which has done some great work and is mostly focused at this point in the upcoming session. We're going to have a bill about the commitment process for children. And certainly that's something that Voices and many of our partner organizations here have participated in and is an important process. But we're looking bigger than that. We're looking at the entire system. Again, that's just talking about a small population of children who are trying to access services. And we're trying to look at children throughout Virginia, regardless of what their diagnosis is, whether they yet have a diagnosis, and what other co-occurring situations or disabilities that they may have. So I would say that while that is a very important component, we're looking more broadly.
It sounds as if a large part of what we're talking about is funding, making what in Virginia we have said we intend to provide to children really available. Is any of the reform focused on whether what we say we're going to provide default services, for instance, is appropriate and needed, that those need?
I think certainly that would be on the table. I think what you find, though, when you look in the code, different from adult services, the 12 key services that the Inspector General identified are not required in code to be provided. So those were just identified as the important things that children with mental health needs, as well as intellectual disabilities and substance abuse needs. Those are sort of the basics of what they need in the community. But when you look in code, the CSBs are only required to provide emergency services and case management as funds allow. So, you know, should that be in code? That's a question. Should it be those 12 services? Certainly that's something that will be discussed. But that's really a policy issue that we, in Virginia, have made the decision that we're not going to mandate anyone to provide any of those other services.
Could you then compare that to other states in the nation, whether they have those kind of mandates in code, and how do we compare with them in Virginia?
I don't think we have any systematic picture of that particular issue nationwide. It's pretty obvious that the campaign will be trying to assemble lots of documentation and evidence, both for system deficiencies, but also looking at model programs and model approaches elsewhere so that we can transfer some of those effectively to Virginia. So we have a lot of homework to do in the course of a campaign to establish all of those pieces of information and assemble it all together in a coherent way. That's part of the campaign, obviously, not just on the public support and political will side of things, but on the policy side as well.
What can you do if there are not a sufficient number of psychiatrists to skilled providers who really know what to do with these kinds of cases? Because it seems like there's a real shortage.
You're right. There's actually a national shortage of child psychiatrists, and unfortunately, even though we have 3 universities in Virginia that train child psychiatrists, we're not ever going to train enough to really get up to speed. And so I think one of the key things is to be able to train other folks who are seeing children, whether they're pediatricians or nurse practitioners, psychologists, social workers, other professionals who have training in working with children need to have the opportunity to get up to speed on best practices. And that's one of the things our campaign will be looking at. There are also opportunities for telemedicine that have been used before and ways to make the most out of the wonderful child psychiatrists that we already have in Virginia. They tend to be clustered around the hospitals, obviously. And so there are many regions in the state that just don't have access to a child psychiatrist at all. And so we have to be a little creative about how we're going to spread their knowledge and all around the state. Any other questions?
One of the things that the Virginia Tech shooting brought out was the lack of consistency or connection between the public school system, kids in public school systems, and the older children going into higher education. Is that one of the gaps, and what is, if so, what could possibly be done to narrow that?
Yes, it's an issue for sure. There's lots of these coordination issues throughout the system, not just with the education domain, but other domains as well. And they're very prominent in the histories and personal stories of the families who have encountered all these difficulties. So we know a lot about what it feels like for families trying to access services and run into these roadblocks, not know which system they're supposed to enter through and how to make things work and get everything coordinated. But we don't have a prescription yet for how to solve either the coordination problems with public education or the ones with other domains. Again, the campaign needs to find out as much as possible about the effective ways to deal with those kinds of issues and make policy prescriptions as well as work on the public will and political support for these children. So, again, we don't have the prescription. We're going to be working with our partners to figure all that out. Well, let me just make one point in addition. It's a good opportunity to add in that there are many, many very dedicated and very competent professionals working in the various systems that serve kids. And the deficiencies in the system, the things that we're talking about right now, should not be interpreted as criticism of those very dedicated and competent professionals. These are system and systemic issues that need to be addressed. And the people who are working in those service systems and those organizations, as dedicated and as competent as they are sometimes just as frustrated as the rest of us with the problems that they encounter trying to make the system work. So we all want the same thing. We all want a system that works. We all want a system that delivers the services that kids need. And we're all going to try to work together. This campaign is obviously outside of government, but we will partner as much as we possibly can with government to figure out what needs to be different and make it work.